Hello everyone! Have you ever thought about how the human body moves? Of course, several joints and muscle facilitate the movement process. But the question is, how does it begin? What initiates the movement? Our role today is to answer most of your questions regarding spinal tumors. Today we have Dr. Kim, who is a leading doctor at Bucheon St. Hospital. He is going to discuss with us everything about spinal tumors from an experienced medical point of view. I'm Ume, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Kim.
Hello.
안녕하세요.
Very nice to meet you.
Likewise.
Can you please introduce yourself?
I am Kim Song-dong. I work at St. Mary's Catholic Hospital in the neurology department, specializing in spinal surgeries. I am the head of the International Treatment Center.
So, Dr. Kim, what is exactly spinal tumors and what are their classification?
Put in a simple way, there are two types of tumors that can occur in the spine. The tumors can be intradural or extradural, inside the beginning in the cells within the spinal cord itself, or grow in the membrane surrounding the spinal cord or the nerve roots that reach out from the spinal cord. Within the intradural tumors, there are those located inside the cover of the spinal cord, the dura, but outside the actual spinal cord, and those tumors that grow inside the spinal cord. Even with that division, there are many types of illnesses, but it is too specific, so it is hard to explain all today. Today we should talk about a metastatic tumor that affects the spinal musculoskeletal area, which can be divided into two types: those that grow within the musculoskeletal area and the metastatic type that enter into the area from another organ through the veins via blood.
Okay, Dr. Kim, second question. So what is the etiology behind spinal tumor?
Most tumors do not have a cause. We have not yet found the causes. Most do not know the root causes. You can think of a normal cell turning into an abnormal cell. Of course, if the tumor was metastatic, we may know where it came from, since it came from somewhere. So you can think of that as the reason.
So which oncological disease most often causes metastasis of the spine?
For men, it is typically lung cancer. For women, it is breast cancer. Also, for men, it could be prostate cancer, blood cancer, kidney cancer, and in Korea, liver cancer. You can say that from all the organs, it can metastasize.
So in the case of spinal tumor, what kind of diagnosis can help find it?
First, we look for clinical symptoms. Most common would be pain in the affected area of the spine. When the nerves are attacked, there can be radiant pain. When the motion nerves are attacked, there can be paralysis. In some extreme cases, the ability to urinate or excrete can be impaired. In terms of exams, visual exams are most useful. We often use X-ray, CT scan, angiography, Gall scan, and PET-CT scan. While there are many diagnosis tools, the best is an MRI with a contrast agent.
MRI. Yeah. So what kind of treatments are out there for benign spinal tumor?
For benign spinal tumors, there is no need for treatment. There are no special symptoms either. They are often discovered by chance, whether there is pain nor other symptoms. Simply do regular checkups to see if the size is growing or if the symptoms are developing. Most do not require any treatment. If treatment is needed, if there is pain, there are many ways to mitigate it. If the spine is unstable, we can use surgery and mechanically reinforce the spine.
How about the treatment for more serious spinal tumor?
For metastatic tumors, we need surgery. Also, for local tumors, the best method is surgery. The basics of surgery is first, to avoid pain. Then, to use stabilize, the correct position, the spinal cord.
네. Can you please explain what is the minimally invasive surgery?
Minimally invasive surgery is used to treat degenerative spinal cords. Simply explained, we make the smallest incision possible in order to limit the damage to the area, which helps us also with the fast recovery post-surgery. In reality, this technique is not ideal for spinal tumor surgeries. However, if the patient is too old and the body condition is not the best, it is difficult to perform a major surgery. In such cases, we can use minimally invasive surgery techniques in order to achieve the desired results.
So what are the devices used for minimally invasive surgery?
So we use many tools and devices. For the basics, we use magnification devices, endoscopes, navigation equipment to be able to see inside, and vertebral augmentation tools.
So minimally invasive surgeries, what is exactly the advantage over classic or traditional ways of surgery?
Like I said before, surgeries done long ago were large surgeries. The incisions were large and very open, and many ended up with inflammation and infections after surgeries. Recovery is faster, so results in higher quality of life for the patients.
So, are there any contraindications for this kind of surgery?
Just because it is minimally invasive surgery does not mean that everything is better. When treating tumors, it is best if we remove all the tumors. But if the minimally invasive technique hinders that goal, then it does not serve the patient's goal too well. So if the patient is young and in good health, it is better to completely take out the tumors by doing open surgery freely.
All right. We're very thankful for your time, Dr. Kim.
Thank you.
감사합니다. Today we learned many things about spinal tumors and their different types. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.